So I'm going to talk a little bit about how we use the Therastim, or how we use the Therastim, and now use the Globus Phoenix Edition to treat sports injuries, sprains and strains at our office, the way we do it here. Now we're talking about someone walking in with, let's say, I have a knee pain, or I have an ankle pain. I'm not talking about just your stiffness person right now. We have specific mobility protocols for that we talk about in other videos. And I'm not talking about strength training right now. We have other stuff that we focus in on that. So I'm just talking about someone comes in, they have a complaint of knee pain while running, okay? So what we first do is obviously we put them through our normal orthopedic and muscle testing examinations. And let's say we come up with a diagnosis of patellar tendonitis, okay? So a person comes in, they got pain over their patellar tendon, okay? What we do at our office, we got to think of it a couple of different ways. One, we have one diagnosis, which is, let's say, the patellar tendonitis. And then two is why did that person get patellar tendonitis in the first place? Is it because they have a lot of trigger points or stiffness or something going on in the quads and hamstrings? Some point dysfunctions within the ankle joint, okay? So, because a lot of times, if someone comes in with just knee pain, oh, you got patellar tendonitis, let's take some type of muscle stim and put it in a knee. Okay, that's great. Maybe that affects the inflammation where the knee is, or the patellar tendon, or the pain is, but that might be just a symptom. The true problem might be due to issues up in the quads. So what we did is we used to use this Therastim for years. But now we've moved over to a more compact device called the Phoenix, which has a very similar waveform and specs as the Therastim, what we did. So, person comes in with okay, they got pain in the knee. We now make the diagnosis of they got patellar tendonitis. So the way what we actually do is we're not going to jump right to that knee and treat that inflammation in the knee. What we're going to do is hunt around in the quadriceps, in the glutes, in the hamstrings. We basically want to hunt around in the muscles all over, above or below that joint that could have an effect on that. So what we do is we take a ground wire, usually load it up here in the hip. If we're using these carbon pads, we lay a sponge, or on the ground we could use actually a self-adhesive. So we put a sponge on this. The person would come in, we put it on their hip over here. Obviously they put it on their skin. And then what we do is we turn it up to a setting on here called the Phoenix. The waveform on that is very similar to 500 parts per second at a constant, or 20/20 when we use the Therastim. So what we would do then is we would just kind of search around. So we just turn it up where the person gets a slight tingling type of feeling, and we would hunt around in the TFL, down through the quadriceps, into the adductors, and we're not looking for necessarily going over a motor point that will cause a contraction. We're looking for more an irritation, or the patient won't know. It's kind of hard when we describe this to the patient, because we just say, you'll know it when you kind of feel it. We're looking for basically an active trigger point. So we might go over a trigger point and the person feels a discomfort. That's what we're looking for. We're looking for actually a little bit more of a discomfort on the patient. So we might go over here and the patient goes, whoa, that's a little uncomfortable. And they even may get a radiation of that trigger point down the leg, or up that referral pattern that those trigger points have. So what we would do then is we would hunt around, and we would use typically a marker. And when we find a discomfort area on the person, we would make a little mark. And then we would search down, and say in the hamstring, we make another mark, okay? So let's say we found, 4 areas that are discomfort. Then what we do is we would take these electrodes off. We then take the self-adhesive pads, and then we put them over those spots that we found on the quads or the hamstrings. And then we would turn this up to get a nice, good contraction, or a discomfort, maybe 5, 6 on a scale of 10. The person may have shooting pain radiating down the leg or up there. And then I will have them, typically if it's a leg, I'll have them do some squats, or kind of stimulate that they're kind of riding a bike. After a few sessions or repetitions of that, the intensity may drop down a little bit, and then we increase it up. We typically do this for about 8 minutes. And then what we do is we reverse the polarity of the current. And basically it just means if we have two pads here and here, the current's going one to the other, and then we would change the leads and have it go the other way. This is what we're doing. This is what a lot of places don't do. They don't do looking around the other areas at the fact. Most places go off and will just treat the like the patellar tendon they did. So we do about 16 minutes or so, 20 minutes or so of that work. And then what we'll do is then we'll go over the area of the irritation and just sandwich that area like around the patellar tendon. And we get really good results with that because we're not just addressing the symptom, okay? So we really try to focus on hey, that's nice your pain's there, or that's nice your pain's in your bicipital tendon right here, but how did you get that tendonitis in the bicipital tendon in the first place? And again, we would hunt around the chest, we find those active trigger points, then we put the pads on that, have the person do a little bit of throwing or movements. We have a little bit more specific protocols on movements. And then after about 16 to 20 minutes, then we will take the pads off the areas that we found in the shoulder or the areas that we found in the quadriceps, and then put it directly over the area where they have the sensation and maybe treat that again for about another 16 minutes.